As your pet ages, there's a really good chance that at some point your veterinarian is going to look at their teeth and recommend you bring them in for some dental work. This is usually advised to be done under full anesthesia, and that can be really scary for pet parents because as our babies get older, we worry about the risks of anesthesia. But your veterinarian has very good reasons for recommending this procedure be done this way. So today I want to help address some of those concerns and just explain to you why we recommend general anesthesia for dental procedures. The first reason is that to do a really thorough cleaning, we really need your pet to be asleep. Now, it is possible on an awake or sedated patient to sometimes chip off the tartar that you can see if you just lift up their lip and make the teeth look better, but it is not possible to get up under the gums. So, most people don't realize this, but most of the disease and all the nasty bacteria and gunk is actually up under the gum line where we can't see. And it's just not possible to clean up there on an awake patient without causing them a lot of pain. We also can't get to the insides of the teeth. Even the most docile golden retriever is not going to hold their mouth open long enough for us to scrape the insides of the teeth, so that part gets missed. And then finally, it's not possible to really polish teeth on an awake or sedated patient. Polishing is important because as we scrape the tartar from the teeth, we're creating grooves in the enamel, and those grooves can be a place for bacteria and plaque to grow back really quickly. So we really need to smooth it out to prevent the problem from coming back very fast. The second reason is for safety. So by putting a pet under full anesthesia, what we're able to do is insert a breathing tube, and that protects their airway. As bacteria and gunk and all that stuff is flying around, we don't want that to accidentally get into their airway and go down into their lungs. So that is a very important safety factor. The final reason is to do a really thorough and complete exam and detect problems that might be causing pain and discomfort that your baby can't tell you about. We need to really have them asleep. So, again, we want to be able to probe up under the gums and check for deep disease that can be very painful but is just not visible to the naked eye. And if possible, taking x rays can detect even more underlying problems. So, these steps are really important if you want to do the best you can for your baby. I know anesthesia can be intimidating, and if you're worried about it, please talk with your veterinarian about the risks for your baby and see whether it makes sense for them. But if they're recommending this dental work be done for your pet, they probably have a really good reason. I hope this allows you to give your pet the best health care they can get as they age. My name is Carolyn Nahn, and I am the owner and medical director of Arms of Aloha, where we believe every pet deserves peace, comfort, and dignity at the end of their life. If this was helpful, please share it with your friends. If you have other topics you'd like me to talk about, please do leave us a comment. Mahalo.